It was a typical Friday night at Riverside General Hospital. The air was still, almost eerily calm. The usual hum of medical equipment provided a constant, low-level background noise, a familiar soundtrack to the staff. Nurses and doctors went about their routines, tending to patients with practiced efficiency. Little did they know that February 19, 1994, would soon transform from an ordinary night into one etched in medical mystery. At 8:15 p.m., paramedics wheeled a critically ill woman through the emergency room doors. This was Gloria Ramirez, a 31-year-old mother of two. She was suffering from advanced cervical cancer, a diagnosis that had already taken a heavy toll on her body. Her breaths were shallow, her heart racing, each moment a struggle. Her condition was dire. She needed immediate attention. The medical team sprang into action, their training kicking in instinctively. Unbeknownst to the medical staff, Gloria's arrival would trigger a terrifying chain of events. Something unprecedented was about to unfold. It would leave an indelible mark on the hospital and its staff, raising more questions than answers. The night would be remembered for its inexplicable occurrences, and it would forever be known as the Night of the Toxic Lady, a case that baffled medical professionals and left a lasting legacy of mystery and fear. As the medical team went to work, a strange, sweet, fruity odor began to permeate the air around Gloria. It resembled the smell of overripe fruit. Some described it as more chemical, like garlic. The odor intensified as Gloria's condition deteriorated. Susan Kane, a registered nurse, drew blood into a syringe. As she did, she noticed an unusual ammonia-like smell emanating from the tube. Moments later, Susan fainted. She was moved to another room, disoriented and nauseous. Another nurse, Maureen Welch, took over attending to Gloria's blood sample. She, too, was overcome by nausea and dizziness. She stumbled away from the bedside, feeling lightheaded. The room, now thick with the cloying odor, began to feel suffocating. Fear and confusion gripped the remaining medical staff. What was happening? Could this mysterious illness be airborne? Meanwhile, Gloria's condition continued to worsen. The medical team was at a loss, their usual confidence replaced by a palpable sense of dread. Every passing moment seemed to bring a new, more alarming symptom. She was slipping in and out of consciousness, her breath shallow and labored. The beeping of the monitors grew more erratic, mirroring the growing panic in the room. Her skin took on a peculiar, oily sheen, glistening unnaturally under the harsh hospital lights. It was as if her body was secreting some unknown substance. It was almost as if an oily film covered her entire body, a sight that left even the most seasoned doctors baffled and uneasy. Doctors struggled to understand what was happening. They ran test after test, but the results were inconclusive, only adding to their frustration and fear. They had never encountered anything like it before. The usual protocols and treatments seemed ineffective, leaving them grasping at straws. As more medical staff crowded around trying to help, others also began to feel ill. The air in the room grew heavy with a sense of impending doom. Some complained of burning eyes and a metallic taste in their mouths, symptoms that seemed to spread like wildfire among the staff. Others experienced difficulty breathing and muscle spasms, their bodies reacting violently to an unseen threat. The symptoms were erratic, affecting people differently. Some were mild, while others were severe, but all were unsettling. The situation spiraled as more staff members succumbed to the mysterious illness. The emergency room, once a place of order and efficiency, descended into chaos. The hospital, typically a place of healing, felt more like a horror film set, the air thick with fear and the unknown. The usual hum of activity was replaced by an eerie silence, punctuated by the occasional cry for help. The question on everyone's mind was Gloria the source of this bizarre illness? The uncertainty gnawed at them, as they struggled to find answers in the midst of the unfolding nightmare. With the situation escalating, the hospital initiated emergency protocols. The ER was evacuated. Patients, some still hooked to IV drips, were wheeled into the parking lot. Doctors and nurses, many themselves feeling ill, struggled to maintain order amidst the chaos. Inside the now deserted ER, a skeleton crew of medical professionals wearing full protective gear continued to work on Gloria. They intubated her, hoping to stabilize her breathing. But it was too late. At 8:50 p.m., just 35 minutes after arriving at the hospital, Gloria Ramirez was pronounced dead. The mystery deepened. What had caused Gloria's rapid decline? And what was the strange illness that had sickened so many medical professionals? The search for answers was only just beginning. The following days were a whirlwind of activity. The Center for Disease Control, or CDC, was called in to investigate. The hospital's ER remained cordoned off as a hazardous materials team, clad in hazmat suits, combed through the area. They meticulously collected air samples, surface swabs, and Gloria's medical equipment, searching for clues. Speculation ran rampant. Was this a case of bioterrorism? Had Gloria come into contact with some unknown, highly contagious pathogen? The theories, ranging from the plausible to the outlandish, reflected the fear and uncertainty surrounding the case. The eyes of the world were on Riverside General, waiting for answers. The pressure mounted on investigators to determine what had happened to Gloria and, more importantly, whether the public was at risk. Weeks later, the CDC released their preliminary findings. They had discovered traces of an unusual chemical compound in Gloria's blood dimethyl sulfoxide, or DMSO. DMSO was a solvent, often used as a topical pain reliever. It was also known to be an industrial solvent. Chemists proposed a theory. Perhaps Gloria had been using DMSO to self-treat her cancer pain. If she had overdosed, it could explain the oily sheen on her skin. But how could DMSO have caused the strange symptoms in the medical staff? The theory posited that Gloria's blood, rich in DMSO, had reacted with the oxygen in the air. This reaction, they suggested, could have produced dimethyl sulfate, a highly toxic gas. Could this be the missing link, the explanation for the mysterious illness? While the DMSO theory seemed plausible, it wasn't without its flaws. The idea that a common solvent could transform into a deadly gas under the right conditions was intriguing, but it left many questions unanswered. Some experts argued that the chemical reaction proposed by the CDC was improbable under the conditions present in the ER. They pointed out that the temperature and pressure required for such a reaction were not consistent with the environment in the emergency room that night. The amount of dimethyl sulfate required to cause the reported symptoms, they argued, would have been far too high to have been produced in that environment. This led to a search for alternative explanations, as the medical community struggled to make sense of the bizarre incident. Some suggested that the medical staff had experienced mass hysteria, a phenomenon in which a group of people exhibit similar physical symptoms in the absence of a physical cause. This theory posited that the stress and fear experienced by the staff could have led to a collective psychological response. The stress of the situation, coupled with the unusual odors, could have triggered a collective psychogenic illness. This type of illness is known to occur in high-stress environments where anxiety and fear can manifest as physical symptoms. Yet, this explanation also failed to satisfy everyone. Many found it hard to believe that seasoned medical professionals could be so profoundly affected by mass hysteria, especially given their training and experience in handling emergencies. The symptoms experienced by the medical staff, some of whom were seasoned professionals, were too specific, too varied to be easily dismissed as mass hysteria. The range of symptoms, from fainting to shortness of breath, suggested a more complex cause. The mystery of Gloria Ramirez, it seemed, was far from solved. Despite numerous theories and investigations, the true cause of the strange events that night remains elusive, leaving a lingering sense of unease and curiosity. As months turned into years and the investigation stalled, whispers of a cover-up began to circulate. Some believed that the hospital, eager to protect its reputation, had downplayed or even concealed information about the case. Others suspected that the authorities were withholding the truth, perhaps to avoid public panic. Gloria's family filed a lawsuit against the hospital, alleging negligence and demanding answers. The case dragged on for years, fueling speculation and conspiracy theories. The lack of a definitive explanation only added fuel to the fire. The Toxic Lady case became a cautionary tale, a reminder of the unknown and the potential for unexplained phenomena to disrupt our seemingly ordered world. To this day, the case of Gloria Ramirez remains an enigma. No definitive explanation for the strange events of that night in 1994 has ever been found. The DMSO theory, while the most widely accepted, is not without its critics. Mass hysteria, though a possible factor, fails to account for the severity and specificity of the symptoms reported. The enduring mystery of the Toxic Lady serves as a chilling reminder of the limits of our understanding. It highlights the fact that, even in our technologically advanced world, there are still phenomena that defy explanation. The case stands as a testament to the power of the unknown and the enduring human fascination with the unexplained. And so, the question remains, what really happened to Gloria Ramirez on that fateful night in Riverside?